A fall often begins with something so small you barely notice it. Your toe catches the edge of a rug, your slipper brushes the floor, your foot does not lift quite high enough over a doorway. Then, before you can correct yourself, your body is moving forward and your hands are reaching for something that is not there. I am Dr. Daniel Brooks, and if you are over 70, there is one walking habit I want you to notice today. Are you lifting your feet, or are you quietly sliding them across the floor? Many older adults believe they are walking carefully when they take very short steps, look down, and keep their feet close to the ground. But this pattern can actually make falls more likely. It is called a shuffling gait, and it often develops so slowly that neither the person nor the family notices it. A small reduction in confidence leads to shorter steps. Shorter steps lead to less foot clearance. Less foot clearance makes the person look down. Looking down pulls the upper body forward. And once the body is leaning forward while the feet are barely lifting, even a small obstacle can become dangerous. Now, I want to be careful with the advice I give you. Some people will tell every senior to force the heel far forward with every step, but that can create overstriding, which may make balance worse. The goal is not to reach farther than feels natural. The goal is simpler. Stand upright, lift the foot clearly, place the heel gently, roll through the foot, then push away through the toes. That is the walking pattern we are going to rebuild. Not a dramatic stride, not a military march, a clear, controlled step. Now, why does shuffling become common after 70? The first reason is muscle weakness. The muscles at the front of your lower leg lift the toes. The hip muscles lift the thigh. The glutes help push the body forward. The core keeps the trunk upright. When these muscles weaken, the foot does not clear the floor as well. The second reason is fear. After one close call or one fall, many people become more cautious. They shorten their steps because smaller steps feel safer, but the foot begins sliding instead of lifting. The third reason is reduced sensation. Diabetes, vitamin B12 deficiency, nerve damage, spinal problems, or poor circulation can make the feet feel numb or disconnected from the ground. The fourth reason is joint stiffness. Tight ankles, painful knees, weak hips, or arthritis can reduce the natural rolling motion of walking. And the fifth reason is a neurological condition. A new shuffling gait can sometimes be related to Parkinson's disease, stroke, medication effects, or other nervous system problems. So if your walking pattern has changed suddenly, if one leg drags, if you have new weakness, or if your steps have become much smaller without explanation, speak with your doctor. Do not assume it is simply aging. Now, let us focus on the walking change itself. Stand beside a kitchen counter or sturdy wall. Look forward, not straight down. Let your shoulders relax. Keep your chest comfortably upright. Now take one slow step. Lift the foot enough that your toes clearly leave the floor. Move it forward only a comfortable distance. Let the heel touch gently. Then allow your weight to roll through the middle of the foot toward the toes. Push lightly through the toes as the other foot begins to move. Think of 4 words: lift, place, roll, push. Lift the foot, place the heel, roll through the foot, push through the toes. Do not slam the heel down. Do not stretch the leg too far ahead, and do not rush. Your step should feel smooth, not forced. Now try the other side. Lift, place, roll, push. This one small change improves several things at once. Lifting the foot reduces the chance of catching a rug or uneven surface. A gentle heel-first landing gives you a clearer contact point. Rolling through the foot improves control. Pushing through the toes helps move the body forward without leaning. And looking ahead keeps the upper body more upright. But one practice session is not enough. You have to teach the nervous system to use this pattern automatically. That is why I want to give you 5 simple exercises. The first is the conscious hallway walk. Choose a clear hallway with good lighting. Remove rugs, cords, shoes, and anything else that could become a trip hazard. Keep one hand near the wall if you need support. Walk 10 slow steps. With every step, think, lift, place, roll, push. Do not worry about speed. Your goal is to feel each part of the step. At the end of the hallway, stop completely before turning. Use several small steps to turn. Do not twist quickly on one foot, then walk back. Repeat this 2 or 3 times. This exercise is not about fitness. It is about rebuilding the pattern. Now, here is something important. Many falls happen during turning, not during straight walking. A person walks safely across the room, then tries to turn quickly. The feet cross. The body keeps moving. Balance is lost, so practice turning slowly. Use small marching steps. Keep your feet apart. Let your whole body turn together. Do not plant one foot and twist sharply. That one habit can make daily movements safer. The second exercise is seated toe lifting. Sit near the front of a sturdy chair with both feet flat. Keep your heels on the floor. Lift your toes and the front of both feet upward. Hold for 1 second. Then lower slowly. Repeat 10 to 15 times. You should feel the muscles along the front of your lower legs working. These muscles help keep the toes from dragging. If they are weak, rugs, doorways, and pavement cracks become more dangerous. Start with 1 set. Gradually work toward 2 or 3 sets. Do not force through cramping or sharp pain. The third exercise is marching with support. Stand behind a strong chair or at a kitchen counter. Place both hands lightly on the support. Lift one knee a few inches. Lower it. Then lift the other knee. Move slowly. Do 10 marches on each side. You do not need to lift the knee high. You only need enough movement to train the hip muscles that help bring the leg forward. Keep your body upright. Do not lean backward. Do not pull heavily on the counter. The support is there for balance, not to carry your full weight. As this becomes easier, try touching the counter with only your fingertips, but never remove support if you feel unsafe. The fourth exercise is the controlled heel-to-toe rock. Stand near a counter. Keep your feet about hip width apart. Shift your weight slightly backward toward your heels without lifting your toes too high. Then shift forward toward the balls of your feet. Rise onto your toes only if you can do so safely. Move back and forth slowly. This teaches your body how weight moves through the foot during walking. The movement should be small. Do not lean so far that you feel unstable. Repeat 10 times. This exercise strengthens the ankles and improves the body's ability to make small balance corrections. Those tiny corrections happen with every step, even though you do not notice them. The fifth exercise is stepping over a low object. This one should only be done if you can stand safely with support. Place a rolled towel on the floor. Do not use a hard object. Stand near a counter or wall. Step toward the towel slowly. Lift one foot clearly over it. Place the heel down on the other side. Then bring the second foot over. Turn carefully and repeat. Do this 3 to 5 times. The goal is not height. The goal is learning to see an obstacle, lift the foot early, and clear it without panic. Do not begin with an object several inches high. A flat rolled towel is enough. And do not carry anything while learning this exercise. Now I need to correct a dangerous idea that sometimes appears in walking advice. Do not practice walking with your eyes closed. Vision is one of the main systems your brain uses for balance. Removing it can sharply increase fall risk, especially in older adults. Keep your eyes open, use good lighting, practice near support, and have another person nearby if your balance is poor. Safety comes before progress. Now let me tell you about a patient I will call Henry. Henry was 78. He had fallen once in his kitchen and twice nearly fallen outside. He blamed the rugs. His daughter blamed his slippers. But when we watched him walk, the real pattern became clear. His steps were extremely short. His toes barely left the floor. He leaned forward and watched the ground directly in front of his feet. He believed he was being cautious, but his body was constantly moving ahead of his feet. We did not ask him to take huge steps. We worked on 3 things: looking several feet ahead, lifting the toes, and placing each foot clearly before moving the other. He practiced in his hallway for a few minutes every day. He also did seated toe raises and supported marching. After several weeks, his walking looked more controlled. He was not suddenly young again. He still used his cane, but his feet cleared the floor better, and he looked less frightened while moving. Then he said something important. I did not realize I had stopped walking. I had started sliding. That is exactly what happens to many seniors. Now, walking technique matters, but your home also matters. Remove loose rugs or secure them properly. Keep electrical cords away from walking paths. Improve lighting in hallways and bathrooms. Use night lights between the bedroom and toilet. Wear shoes that fit properly and have a non-slip sole. Avoid loose slippers that slide off the heel. Keep commonly used objects within easy reach so you do not climb or stretch unnecessarily. And if you use a cane or walker, make sure it is adjusted correctly. A cane that is too high or too low can change posture and make walking harder. A physical therapist can check this quickly. Now, let us talk about arm swing. When people become afraid of falling, they often hold their arms stiff against the body, but natural arm movement helps balance the trunk. Do not force a large swing. Just allow the arms to move naturally as the opposite leg steps forward. If you use a cane or walker, follow the pattern taught by your physical therapist. Do not copy another person's technique. The correct pattern depends on the device and which side needs support. Now, there are warning signs that need medical attention. If one foot suddenly begins dragging, seek medical evaluation. If walking changes after a stroke-like symptom, call emergency services. If you develop new weakness, severe dizziness, fainting, or loss of coordination, get urgent help. If your feet are numb, ask about diabetes, nerve problems, vitamin B12, circulation, and medication effects. If you freeze while walking, feel unable to start a step, or notice very small steps with shaking or stiffness, speak with a doctor. And if you have fallen more than once, ask for a fall risk assessment or physical therapy referral. A fall is not always bad luck. It may be a warning that balance, strength, vision, blood pressure, medication, or walking pattern needs attention. Now, here is your simple daily plan. In the morning, do 10 seated toe lifts, then perform 10 supported marches on each side. Practice 10 careful steps in a clear hallway. Later in the day, repeat the hallway walk. During normal walking, remember 4 words: lift, place, roll, push, and keep your eyes looking ahead. Do not stare at the floor directly under your feet. Look several steps ahead so you can see obstacles early while keeping your posture upright. If you need to check the floor, glance down briefly, then bring your eyes forward again. Now, do not expect perfection immediately. A walking pattern that developed over several years will not disappear in one afternoon. At first, you will have to think about every step. Then, with repetition, the movement becomes easier. The brain learns through practice. The muscles respond to what you ask them to do regularly. Small daily practice is more useful than one long session that leaves you exhausted. 5 safe minutes every day can be more valuable than 30 difficult minutes once a week. And remember, walking more safely does not mean walking faster. Speed is not the goal. Control is the goal. Clear foot lift, stable placement, upright posture, safe turning. Those are the things that protect you. I am Dr. Daniel Brooks, and if you are over 70, pay attention to the sound of your feet today. Do you hear a clear step, or do you hear your shoes dragging across the floor? Do not ignore that sound. It may be your body telling you that your feet are no longer clearing the ground properly. Start beside a wall. Lift the foot. Place the heel gently. Roll through the foot. Push through the toes. Then repeat. Because protecting your independence does not always begin with a new medication or an expensive machine. Sometimes it begins with the next step you take. Everything shared here is for general education only and does not replace personal medical care. Speak with your doctor or physical therapist before beginning these exercises if you have recently had surgery, have severe arthritis, dizziness, foot wounds, nerve damage, significant balance problems, or have been advised to limit weight-bearing activity.